So as Cameron said, I'm Sarah and I work for Synergy Capital Management. I don't work for Jetstar, as my husband keeps telling me I look like when I wear this jacket. So I'm just going to tell you a little bit about our health and wellbeing program. So to start with, I'd just like to tell you a little bit about our company. So we are a fund administration company. We're actually owned by AMP, but we are a separate entity and we do work fairly autonomously to AMP. We're medium sized, so we have 47 staff. That's made up of full and part-time staff. We're based in Hobart CBD, and most of our roles are administration roles and all of our roles are desk-based. So, why did we start a health and wellbeing program? The idea, I guess, for this program came from a session that I attended at WorkSafe month in 2011 that Cameron and Samantha ran. And from there, I guess I approached management and had a chat to them about what they thought, and they thought it was a great idea. There was a lot of things that we already did in the office that were kind of for our staff and for that towards their health and wellbeing, but we sort of wanted to formalise this program, which is what we did. And when I spoke to management about this, I guess our goal was basically just to improve the general health and wellbeing of our staff, which in turn we hoped would improve staff engagement and morale, hopefully in time reduce sick leave and improve our productivity. So what did we do? The first step that we took was to engage Cameron and the advisory service, which was fantastic, and he really just helped give me some direction on where we should start, because I really had no idea. The next thing that we did was to get buy-in from the managers at work, and they were really supportive. Cameron came and had a chat to them at one of our management meetings about the benefits of having a health and wellbeing program, and they were really happy to support it, which I think was really, really important. The next thing was to get staff involved. So we asked for volunteers to be on a working group, and we had 6 of us out of 47, which was a pretty good number, and we got together and sort of organised the program and came up with an action plan. We surveyed our staff to find out what areas they felt were important or of interest to them, and then we aligned our action plan with those areas. And so, just to give you an idea of some of the things we did last year, we published a monthly newsletter which just had articles on topical things, healthy recipes, trivia, that sort of thing. We started running fortnightly massages for staff, so that is still going on at the moment. With that, it's at staff's own cost. However, they're given the time during work hours to do that, and staff are quite happy with that. They're happy to pay for it. We got rid of our vending machine, which caused a bit of controversy to start with, but we did replace that with healthy snacks from Nature's Works, and they're going great guns. We set up a library of resources for staff in our breakout room. We organised health checks, had a few guest speakers. We had a scavenger hunt, and when the Olympics were on last year, we had an Office Olympics, which was great fun. We've started encouraging team participation in organised events. So we had 4 people on the weekend do the bridge run. We had, I think, 3 people last year do Point to Pinnacle, and we're hoping to get a bigger group this year to do that. We had lunchtime meditation sessions and walking groups, flu vaccinations. We now have a smoothie club, so every fortnight on a Wednesday morning we make smoothies for the office. We actually charge people $2 for a smoothie, which they're quite happy to pay. And we bought a blender obviously for that, and that's going really well. And we also started linking our health and wellbeing to the community work that we do. So we try and organise a lot of fundraising and volunteering in the office. And that a lot of those things sort of link in with health and wellbeing. For example, Relay for Life, National Tree Day, we had a group go out and plant trees for the morning. and biggest morning tea. And all those things have worked relatively well. So there's a few photos of some of the things that we've done. We've got the guys from Relay for Life, our Office Olympics, and some of the food we had at the biggest morning tea, where we had traffic light options. So every food that was brought in, we told people whether that was a green, amber or red option for them, just so that they knew. So 2013, what have we decided to do this year? The first thing we decided to do was put together a new health and wellbeing community. The reason for that was we just wanted some new and fresh ideas, and also to give other people an opportunity to be involved. So we've got 4 people this year on our group. We had our first meeting last week, and we decided that we would like to survey staff again and find out from the activities that we ran last year what they actually enjoyed or what they didn't enjoy, and maybe get some ideas from them about things that they would like. And some of the ideas that we've already come up with are more guest speakers, because they seem to be really popular with staff. Pedometer challenge, which we're hoping to start in the next few weeks, where we'll get teams of people to band together and try and take as many steps as possible, and we'll have prizes for team winners and individual winners. We'd like to do skin checks, and hopefully some more staff engagement activities such as scavenger hunt, orienteering and perhaps corporate games. So that photo there is from the last scavenger hunt that we had, where staff had to go out with a camera, and we gave them clues, and they had to try and work out what they had to take a photo of from the clues that were provided, which was a lot of fun. So the outcomes, I guess from my point of view, the biggest outcome has been an improved engagement by staff, and staff morale I think is really good at the moment. We've had some individual cases where I think staff, and one person in particular, have made dramatic improvements to their health, which is a really positive thing. I think our office is a happier place to work with this program, and obviously we're hoping that there will be some longer term benefits, such as a decrease in sick leave and a reduction in turnover of staff. But I think we'll probably have to wait a little bit longer to see those results. And that's about it. I suppose I just wanted to say that really I probably couldn't have done this program without the support of Cameron and the advisory service. They've been fantastic. Cameron sort of really helped get it up and running, and he attended a lot of our initial meetings and spoke to the staff and spoke to the managers about why it was a good idea, and that really helped get the managers on board and that sort of thing. So I think it has been really successful, and I hope that it continues to be successful in the future.